Tamil Nadu.
Thank you, Arnagiri, for your nice introduction of your MSN AARAICHI program. Very glad to know that AARAICHI will improve the status of the MSN, and they will have the knowledge about all the facts and what are all going to improve their studies, and it will help in all the ways. So it should be so you must start a library. You must have the library to have the vocabulary and knowledge and everything to know the current activities which are going on, and everything should be noted, and guide should be done. So I am very happy to inaugurate the Arachi for the MSN, and it will have the good effect on all the people who are going to take this subject. With all the best wishes, thank you.
Thank you. Thank you so much, sir. Dr. Habulasan, sir, could you please share a few words?
Good evening, and thank you, Arnagiri, Dr. President, Dr. Sengutan, Secretary, Dr. Karthik Prabhu, and Dr. Gauri, our Finance Secretary, the galaxy of MSN JDN leaders, Dr. Hariharan, Dr. Adamale, Dr. Jamuna, Dr. Thiru, and all the MSN office bearers. I am very happy that Arnagiri has taken this huge step to improve the research capacities of our young minds in the medical profession. I'm sure this should be one of the first of its kind, maybe the entire country. MSN from the MSN platform, always MSN set trend. MSN of Tamil Nadu sets trend for other MSN units to follow. This is one of such a kind that we will set trend for other state units to follow. I'm sure doing with the wonderful titles like Artral, and this RH also definitely become very popular among the people, among the medical students of our state. I wish this particular measure a huge success, and I am very happy that our President, Secretary, and all are here, and definitely this particular movement will get enough support to reach good heights. Thank you very much for the opportunity. Best wishes, Arnagiri.
Thank you. Thank you so much, sir. Over to you, Dr. Karthik Prabhu, sir.
Yeah, respected President, Abul sir, dear Hari, Arnagiri, Charan, and all MSN, JDN chairmen and friends, Annamalai sir, and everybody, good evening. This topic I'm very happy because I would like to say one thing, because when I was doing my post-graduation in dermatology, there used to be a regular program called Research Methodology and Thesis in PSG Institute of Medical Sciences conducted by the Department of Community Medicine. And my chief, Dr. C.R. Srinivas, used to take a lot of classes on research. So this helped me have around 7 to 8 publications in my PG time. So he used to say one thing very easily that, see, for example, if you have to make a change in hypertension, you have to do a multicentric trial with a lot of more than, lakhs of people to prove something which is already there and to reprove that it is the same thing which is going on. Or the simplest thing is you contradict something. You make a small trial and give some theory which disproves the larger faith. That will at least come as a editorial column and it will be fast accepted. So it's like that, like what you want. And nowadays in post-graduation and when you apply abroad, everything is important. Like your academic curriculum is viewed by the number of awards, not only by the academic awards, but also by the number of research publications you have, especially when you plan abroad. And I think in MSN, when we start at this stage, rather than the post-graduation. I'm sure many students, whatever they do, will have a structured understanding of how things move on. And very nicely, you brought in the speaker of the day, who is an associate professor in community medicine from Bharat Medical College, Dr. Eka. Beautiful. So hope to see, and I wish you all the very best. And such programs, not only here, research is something which is ongoing and important, and to show that we are also part of the academic curriculum, research should go on. There are a lot of things associated with that, and it is not much spoken about, but yes, it is the need of the hour also. Thank you. Best wishes to Team MSN. You chosen the topic very nicely, very useful. All the best to everybody. Thank you.
Thank you. Thank you so much, sir. Over to Hariharan, sir.
Thank you, Aranagiri. Respected President, sir, Abul Hassan, sir, Karthik Prabhu, sir, Gauri Shankar, sir, Annamalai, sir, Jamna, madam, and Charan, and all other leaders of MSN and JDN who are here. I think it's a wonderful initiative by MSN IMA Tamil Nadu for bringing research as to the forefront. And nowadays, youngsters have lots of research aptitude, and it is good to channelize it through IMA over here. It is great to hear 85 young doctors are interested in research, and hope we have a publication of 85 papers in a year's time, so that it will make us proud again. We have many programs in lineup, including Artrel, ASAN, and the valediction of the acute critical care course. So stay tuned for more updates. Thank you so much.
Thank you so much, sir. Thank you so much. We will definitely make through this for sure, sir. And I would like to hear from our Akka Shrija Akka. Could you please share a few words about this?
Yeah, actually being post-intern and for preparing for PG, I also want basics of research for me. So this is a nice initiative from Arunagiri and team and the MSN team was behind this. And this will be a great opportunity for me and all the JDN members and all the MSN members who are studying right now. So AARAICHI is going to be amazing, and I wish everyone to participate and give all fullest. So this is going to be a lasting, great initiative from the team. So all the best, Arunagiri and team. Wish we will back you up every time and we'll make it a grand success. And thank you all the IMA leaders who have initiated and inaugurated this. Thank you.
Thank you so much, Ka. I would like to call Raghuana to share a few words about this event now.
Very good evening to all. One of the great initiative taken by Arun and the present team of IMA-MSN. So I started my research again with the help of the IMA-MSN previous vice chairman Jamuna ma'am, who actually taught me, and of course it was Venkatesh sir, along with whom I have published my first paper. So with the great minds together, I feel that this is going to be a fantastic initiative, and I wish all the best for the entire team. Hope that this RIC is going to be a fantastic platform for the entire MSN team to know and to learn about the research. Thank you, Arun, once again.
Thank you so much, Anna. Anyone in our state team could want to share few things about RIC? Any of our participants? So yeah. Once again, I want to mention this RIC isn't about all over India. From the AIMS, Maulana Azhar Medical College, and Hyderabad, Kerala, Telangana, everywhere we have a team to work together. And once again, I need Darshini, Frank, Lalita, Nitish, Parthasarathi, Rihana, Rishika, Sukanya, Soyambu, Vigneshwaran, Vikram, Zarin, everyone. They have worked tirelessly for this event to happen, and without them, we would haven't done this much so far. And I need to over this session to Vatani for an introduction to our faculty. Over to you, Vatani.
Good evening to all. I am delighted to introduce our beloved community medicine faculty from Bharat Medical College and Hospital, Dr. Rekha Parni ma'am. Dr. Rekha Parni is an outstanding faculty member known for her passion for teaching and her ability to inspire students with clarity and dedication. She has published in various reputed national and international journals, contributing valuable insights to public health and medical education. Beyond her academic excellence, she is deeply committed to shaping future doctors through innovative teaching methods and impactful community work. Truly, she stands as a role model of excellence both as a teacher and as a public health profession. We are glad to have you here today with us, ma'am. Let us get into this session. RIG 2025. Decode the unknown. Research spaces for every curious mind. Over to you, ma'am.
Yeah, thank you so much. Thank you so much. And that was nice introduction. And first of all, I would like to thank you all for this opportunity. Sengutwan sir, Hariharan sir, Karthik sir, and my mentor Jamuna ma'am. Thank you so much for this wonderful opportunity. And this initiative research mentorship program is a wonderful opportunity where this is very nice because it has been started at a very early stage for all the medical students, which will be really helpful. As Dr. Karthik sir said, we ourselves had all these research methodological workshops in our PG period only. So this opportunity is a very nice platform for you all to learn and start at the earliest. So as of now, we have some 7 to 8 publications, but as you are starting really early, you can have more numbers, which can make you look separate or make you more important when you apply for some of the work jobs and preference. You will be preferred in almost all the applications that are being gotten in the institution. So this is a great opportunity, and hats off to all the people who are at the back of the mind of this program. And I'm so glad that I am a part of this program, and it's a great honor to me. Thank you so much for having me. Shall we start the session?
Yeah, thank you so much, ma'am. Thank you so much for accepting our invitation and being a first presenter of our series, ma'am.
Yeah.
It's a pleasure to have you with us, ma'am. Over to you again. Let's start this session, ma'am. Thank you so much.
Thank you so much. So I'm sharing my screen now. Is it visible, Mr. Arnagiri?
Yes, ma'am, it's visible.
So my topic for today's session is Introduction to Research and some of the ethical issues that are being happening while conducting the research. So these are today's session specific learning objectives. So why is this research is needed? Why are we so much interested in doing research? And why do we need at the current, what is the current need? And then we'll, following that, we'll see what is research and what is happening in research. And what are all the characteristics of good research? And what are all the types of study designs that could help you to achieve what you want to, what is your vision in research that you can bring it out. The outcome can be, the implications of your research could be in many ways. So for according to your need, you have to choose a certain specific study designs, and we'll see all of that. And what is the hierarchy of there are various study designs, and there is a hierarchy based on the quality of the research. So we'll see that also. And how can you do this literature search for all of this, and you can come to a conclusion that what study design you can choose and what is the topic of interest, like that. And what are the steps in conducting a research and writing a proposal that will be the major part. because writing a proposal and submitting it to the ethical committee will be the first step in conducting the research. So you will get an idea, you will prepare a protocol or a proposal so that you will present it to some of the experts in the ethical committee, and they will give you some ideas what are all the improvements that is needed and what can be done and what cannot be done. Based on that, they'll give an approval, and then only you can start doing the research. So that will be seen in the ethical considerations in research. So as we all know, so this is a breakthrough in current medical field, where this Intromix vaccine has been released by Russia. So as we all know, can I get some of the answers for which disease the cancer vaccine has been released by Russia? Anyone?
Colon cancer.
Yes, very nice. So it's Intromix, which is mainly for colorectal and some of the brain tumors also, and some of the skin diseases. So the initial vaccines, first they have been released for these cancers, and they are planning it to distribute it for free. And the thing that I want you people to know is, so this happened because of research. So we know there is a problem, there is a cancer, and we don't have any solution. People are dying, and there is a gap. Okay, so we know some of the diseases are happening. We are failing to treat them. We are trying as much as we can, but people are dying. So what can be done? So what is the issue there? And we are trying to address it through research. So these also have been achieved through a series of clinical trials, as they themselves said it, from the trials through COVID vaccines. They have done these research also, and they have succeeded, and they are telling it 100% success rate. We'll see, but it's a good initiative, and it is mainly being done definitely through research only. So this is why we need research. So for your personal benefits, as we all know, the knowledge regarding certain topics, we as such in the book, we may not be able to cover everything. So this kind of research will help you to find out some of the solutions that you are already not aware of, and you can keep yourself up to date. And some of the techniques, some of the procedures, some of the interventions, all these skills are based on the research. Every day there is a new technique, every day there is a new procedure. So every day there is a new diagnostic test that has been upgraded. So learning all this will help you for your career progression. So in this, by having this up-to-date data known by yourself will make you number one in your profession. Okay, and you can do the best to the patients when you have so much of idea. So for a single disease, when you know multiple options, multiple treatment options, you give it to a patient, he is definitely going to be happy. You are not some simple medico who sit in the OPD and write only paracetamol for headache and Rantac for GRD. Okay, when you start reading, when you do research, you are going to have a vast idea regarding each and every disease that is going to help your patients to get a better treatment, and you can also suggest them what are all the preventive measures that they can do from preventing them from getting those diseases again. Okay, recurrence can be prevented, and their family members can be health educated by doing certain things. Okay, so by all these factors, so you will be, by doing all these, you can be a number one in a profession, and you will be set in a separate role in your profession with some of the reputation, and you will get a lot of networking, and you will have a leadership quality where you will work with the team. Research is all about working with your team, and when you have the research cannot be done only by the principal investigator. We need co-investigators to complete the research project. So it is always about team working, and managing all this will help you to develop a leadership quality. So these are all some of the personal benefits you will get while doing a research at this very early stage. So some of the benefits to the community will be as we saw now. So there was a gap in cancer. We don't know how to stop the growth or at least reduce the multiplication rate. But now we have these vaccines. We got this vaccine through research only to fill those knowledge gap. Okay, these mRNA vaccine can reduce the growth of the cancer cells multiplication. This can reduce the number of rate of multiplication of the cancer growth cells. Okay, so these can be filled only through research. Okay, and answering these unknown questions, all these days we never know there is a vaccine existing and we never know it. So only through lots and lots of clinical trials these days came into light, where we came to know that there is an answer for all this and there is a vaccine for all these colorectal cancers and glioblastomas. Okay, and research is always problem driven. As we can see there is an issue. So we as we all saw, it's a similar example only. So cancer is where the patients are dying and we don't have the answers now. It is not about the topic, it is about the problem that there are a lot of deaths in the cancer, among the cancer patients. So we need a solution for it and we are trying to do some of the research and we got the solution now. This is not applicable only for the cancer, but it applies to many diseases. Example, TB. Can anybody name, there's a new regimen now, apart from this HRZD and Group A, Group B, Group C and all. There is a new regimen now that has been introduced by the NTEP. Can anybody name that regimen? Anybody? So is it a big question? Sorry, somebody's...
Instead of ethionamide, moxifloxacin is added, actually.
Yeah, moxifloxacin has been added. Good, very nice. There's a new regimen itself. Can anybody?
Bedaquiline.
B1 regimen.
Yes, BPANM regimen. Yes, that is the... Sorry. So that is a new regimen. You all go and read it. It is an excellent regimen because of this frequent resistance that has been developed to all these Group A and Group B drugs. Now we have come up with this regimen which is working wonderfully. Now only they have started implementing these drugs into the program. So we are trying to solve the resistance, though our problem is drug resistance. So we are trying to work on that problem and we are keep on doing the research and finding a solution. So it is, the research is always the problem driven. So what is the current issue and we are trying to solve it. So I think this this helped you, why you need this session. All the people who have started this initiative definitely is because of these reasons only, and it is going to be very useful for you. Now we are going to the next part. So what is research? Research we are dividing into two parts, re and search, which is re is again doing it again and search is to examine it. Okay, to search again and again also. This word research is searching it again and again to get a solution. So basically the definition is, it is an objective, systematic, scientific investigation of a problem through the collection of data from various group of people and analyzing it and interpreting the results in order to gain the understanding about the phenomena, what is happening, to prevent, to control the disease. First of all, we need to control what is happening, and we also have to prevent what's going to happen in the future. So we need to collect some of the data from the patients, and we have to analyze the reports, and we have to interpret the results, from which we have to, understand the situation, what is happening, and then we have to, frame the program strategies. These can be done to prevent or control the disease, what is happening currently now, and we can, we can have a better outcome. Okay, so research is nothing but searching again and again. So we have many standard treatment protocols. Okay, we all know there are various treatment protocols for each and every disease. Okay, So we do laparotomy, we do, tubectomy for these sterilization procedures. All these are standard procedures. So what can be done to even do some of the better ways to carry out or to prevent such diseases? Okay, so what can be done? So that comes with the research, doing the research again and again. So this is the word hypothesis. You have to know it. So the idea of research is based on this word hypothesis. It is nothing but an idea you have in a mind that you want to be tested to prove it. Okay, whether this hypothesis can be when you do a research, by doing a research or experimentation of some of your idea, and we want to know whether this research has been supported or refuted. To support your hypothesis or to refute your hypothesis, we need to do research. Okay, so hypothesis is a specific tentative statement about the relationship between the two variables that can be tested through a study or experimentation. So there is a difference between this hypothesis and research question. Hypothesis is, if a plant receives more sunlight, then it will be taller. This is hypothesis. This is the idea you have. But you have to test it. To prove it, you have to test it. So you are having a question, you're putting in a question, research question, that is, does more sunlight make plants grow much taller? Okay, so because of more sunlight only, the plants are growing taller. We want to prove it. So what you'll do, you will start examining it, studying it. Okay, what you'll do, you take up 10 to 20 plants. You will keep 5 plants in sunshade, in shades, and 5 plants directly in the sun. Now, after certain period of follow-up, like 1 month, 2 months, 6 months also, you will find out the length, whether the plants which are in shadow without the sunlight are being grown taller, or the plants which have been kept in the sun have grown taller. Okay, with this we follow up, we will find out whether it has grown taller or not. Okay, by the end of 6 months, you will get to the results whether it has grown taller or not, and you can find out whether this hypothesis that if a plant receives more sunlight, then it will be taller, whether it is true or not, whether it has been proven or not. What your study has supported your hypothesis or refuted your hypothesis. That is what we are trying to prove. Clear? I think I'm going good. If anybody has any doubt, you can stop me and ask me questions. Okay, so this is hypothesis. It's just an idea you have on anything, on any disease. It just, this plant example is very, I want you people to know, as you're all in your very early stages of medical field. I want you to give this example. We'll see much more bigger examples in the following slides. So it is nothing but an idea that you're going to put up in your study. So what are all the characteristics when to claim a research that you're doing as a good research? So it should have a hypothesis. You should have the research question. What you're going to study, that has to be created or made clear in the beginning of the research itself. So it should be guided by a scientific question or a problem that has been existing already, and you have to have a specific plan or a procedure to which how you are going to conduct it. And it has to be done by collecting data. Collecting data is nothing but you are going to select certain population, study population who is going to fit in your criteria, and collect data or collect information from them according to, based on the research questions. So these are all the risk factors for hypertension among obese people. So what are all the risk factors? You're going to collect it from them, and you have to interpret that, and you're going to get a results. And what you're doing should be ethically approved. So you have to maintain the patient's confidentiality. All the ethical matters should be followed for a good research. We will see what are all the ethical considerations to be considered in a good research. And the data and the results has to be replicable. What is the meaning of replicable in research? Do you people have any idea? So replicability is nothing but when you do the similar, when you have done a research in a specified population in a specific geographical area, you have found out that these are all the risk factors, and around 23% of the population has hypertension. Okay, you have done in a larger population, like 1,000 population, okay, from a very larger area. The replicability is you do the same study in another 1,000 population in a specific geographical area. The results has to be same. It cannot be different. Okay, the risk factors has to be same. The prevalence has to be same in the geographical area itself. Okay, in that particular geographical area, you divide among themselves and you take up one specific population and you have done it. So it has to be similar in when you do it in the other parts of the geographical area also. That is replicability. Coming to generalizability is, so you have taken only the small portion of that geographical area, right? So you have taken only around that 10,000 population, you have taken only the 1,000 population for your sample, for your study population. Okay. So, but with the results, when as the results shown, these are all the risk factors. Smoking is a risk factor, obesity is a risk factor. All these risk factors should be listed and can be generalized to all the population in that particular area. Okay, results can be generalized. So definitely you can tell them that these are all the risk factors for hypertension in this particular specified population. Like that, we can tell it for a defined area. Okay, when you have initially itself, you have to map one of the area, and you have to have a sampling method. Okay, all these stratified and sampling methods to sample the people from the particular area, and you have the sample population now. And with them, when you do the study, you can do this replicability and generalizability. These are the two main criteria you have when you have to name a research as a good research. Okay. So these are all the study design. This may look very complicated, but only two things you have to remember. When you do some experiment on it, they are called experimental studies. When you just observe, you don't do anything. You're going to observe what is happening to them. What is the disease status? What is the risk factors? Everything will be observed, only observed. That will be in your observational study. Okay. So in this experimental study, we have a randomized control trial and non-randomized control trial. Randomized control trial is when you take the sample size randomly. There are various sampling methods. I think all these upcoming sessions in your series will be regarding all these study methodologies. I am just telling you the outline only. So these experimental studies, RCT, when you randomly choose the samples from a specified population, okay, where all the population, in everybody in the population have a chance to participate in the study. That is called randomization. By doing that part, when you do a research, that is called randomized control trial, and you do some of the intervention to the population. Okay, that comes under experimental studies. All these observational studies can be classified again into two types: analytical and descriptive. So descriptive, it is nothing but, as the name suggests, you are just describing the disease based on the person, place, and time. When did it happen? To whom it is happening, and what is the type of disease, and what is the environment that is there that can help these diseases to occur to the patient. Okay, so under this descriptive study, we have case reports and case series, where case report is nothing but when you take a disease, when you are in the OPD, you are seeing one unique case, like all these brain tumors, anything, any of the unique stage 3 breast carcinoma, anything, you take up that case and you elaborately explain the history and what is the procedure you've done, what is the outcome, everything in detail. That's called case report. And when you have taken a series of cases, similar number of cases, but too many cases, like 20 also, and you write a report on all of them, that is called case series. You are just describing it, okay, based on the time, place, and the person who are affected. Okay, I'm clear? Coming to analytical. Analytical is nothing but you are in descriptives, we don't do any analysis, we don't do any collect data and put it in the Excel sheet, analyze it, nothing in descriptive studies. Description is just explaining what is there in the patients. Coming to analytical, we have cross-sectional, case control, and cohort. Cross-section is you go to a particular place at a time. Only at a single time, you go and collect data and you see what is the prevalence and what are all the risk factors that they have. Okay, so you check for the exposure and for the outcome at the same time. Okay, that is cross-section study. Whereas in case control study, so it starts already we have cases. The name itself you can see, no, there are cases have already occurred in case control studies. So we have cases and you are taking one more population as control to compare them, what is to do, know what is the exposure between both of them that made the cases to have the disease. Okay, so we are trying to find out what is the exposure that led to this outcome. Okay, so we go retrospectively and collect data from them on their exposure, like smoking and cancer. So already they have got the lung cancer. We are going to collect data from them regarding their smoking history. Okay, whether you have been smoking for 20 years, these many years, how many cigarettes per day you smoke, what type of cigarette you smoke, all these details will be asked retrospectively to find out whether this smoking only caused him this lung cancer, and trying to find out whether this control doesn't have that exposure, to find out whether they did not get the disease because of not having that exposure, to prove that smoking caused lung cancer. Okay, and coming to cohort. Cohort is something somewhat similar to case control, but here we don't have cases. That is one of the major difference between case control and cohort. Cohort, we don't see. So here we have outcome already. Cases have already occurred, but in cohort, exposure has occurred. We know in some of the leather factories, they are being exposed to some of the chemicals, but they have not developed any skin cancer as of now. We know, but they are going to have. So based on this exposure history, we are going to follow up them and we are going to find out what is the outcome they are having, whether this exposure has caused them this outcome. Clear? So we are going from exposure to the outcome. So this is cohort study. So where the diseases will occur on the later stage. Cohort is like when you have rare disease, you can do cohort studies for rare diseases, and when there is exposure, when they are going to expose even for a smaller duration, 6 months also in chemical industry, they are definitely going to develop some of the skin disease, we know. So even for a small exposure, they are definitely going to develop disease. So incidence rates are high. Definitely they're going to have a disease, we know. So when that we know, then only we conduct the cohort studies. We do long follow-up will be done in cohort studies. There is an example called Framingham heart study where till now, 75 years, it has been started in 1948. Till now, their various groups have been changed. Until now, they have this Framingham heart study where they were trying to find out what are all the risk factors for coronary artery diseases or cardiovascular diseases. So they have listed so many risk factors, and for every 20 years, they will change the study participant groups like controls and all these. In cohort also, we have two groups, okay, exposed and non-exposed. Okay, in both of them, who is getting the disease? We'll find out. Okay, that is cohort. I hope I gave you some of the ideas. If you have any of you have doubt, I can repeat it also. Okay, so two types, experimental and observational. Experimental is nothing but you do some of the intervention, you do some procedure to make them better. Clear? You do amputation itself. Okay, when you have diabetic ulcer, you do amputation itself to make them feel better. That is experimental study. In that we have RCT and non-RCT. In observational we have descriptive and analytical. Descriptive, it is nothing but describing the disease. That's all. Analytical is we analyze what is happening. Okay, one is cross-sectional, one is case control, another is cohort. I think I'm good. So cross-section is doing things, everything at a time. Case control, you go to the past and collect data from their medical records by asking them histories, by interviewing them through phone calls, anything. By going through all these MRD data, anything you can do and find out what has happened previously in the past. Cohort, you look them now that they're going to have some of the exposure and you follow them for the outcome or the disease to occur. Clear? I think I'm clear. Anybody having any doubts, you can put in the chat box. So this is the hierarchy I was talking about. So there are, so from basics, you have just expert opinions regarding TB or any leprosy, any disease. Okay, you have just background information that cannot be taken as a evidence, okay, to talk about or to treat the patient. Coming to case series and reports, these are very few numbers. All these, this quality of evidence is based only on the number of population involved in each and every study. I'm telling you, yes, definitely, because case series and case reports, as I said, only one case you take, you explain in detail about these history, examination, and the procedure you do, and the outcome of the patient. Case series is more than 10, 20, or 30 of that disease. Case control, around 200,000 also you can see. Cohort is much better because you can do it for many years. You can follow up them, and you can you involve large population, like around 10,000 will be involved in cohort studies. And next comes the RCT, where you do some of the intervention, and you have found out that the outcome is better if you do this intervention. Okay, so there is a proof that you have done some intervention and the people feeling better now. So RCT is better than all these observational studies. Okay, experimental studies are better than these observation studies. And then comes this systematic review and meta-analysis, where all these professionals do. All these experimental and observation studies, all you UG people and PG people can do. And this systematic review and meta-analysis is nothing but you collect n number of studies on the topic of interest you chose already. Okay, there are n number of studies for each topic. If you take TB, there are n number of studies. We will not be able to count also. So we take all the researches that is done, literature that has been done already, and you interpret those results, and you put a result based on all the results of the studies that has been done already. So around 10,000 studies have given these are all the risk factors, and these are all the preventive measures, these are all the better treatment outcome for all these diseases. They will have a report. That is the systematic reviewing of all these articles and giving an analysis. Meta-analysis is nothing but analyzing all these articles and compressing all these results and giving you an opinion. Okay, so this is the hierarchy of quality of research. So when you do systematic review and meta-analysis, that is in the top, and you can do RCT and cohort also. Okay. So these are the two examples I want you people to remember. So because I know I was boring telling you all these experimental studies, analytical studies and all. So I want to tell you some of the stories. So in the left, that is Dr. James Lind, where he had this happened in 1767, I think. It was way more back than 200 years old. Okay, where he was sailing, and he had 12 sailors who had typical symptoms of scurvy. Can anybody tell me what are all the typical symptoms of scurvy? I think everybody knows it.
Bleeding gums and
good. I appreciate it. Thank you so much. Bleeding gums are the major symptoms, and some of the lethargy, joint pain, malaise, everything they'll have. And they had 12 sailors who had these symptoms, but he don't know what is happening to them. So what he did is he divided them into 6 groups. Okay, and for all these 6 groups, he gave some of the treatments. Okay, one group have been given with seawater, one group with vinegar, one group with some of the other fruits like grapes, apple and all, and for one group he has given 2 oranges and 1 lemon for 1 week. But when he looked them after 1 week, this group who had 2 oranges and 1 lemon had a major difference in their symptoms, and others did not recover from the symptoms. But these people made it through, and they are now better. So then he found out that all these citrus fruits are having some of the deficient in this people, and content in the citrus fruits are helping them to recover from these symptoms. So then only we were able to find out that this somebody has raised hand. Any doubt? Can I continue? Arun? Arnagiri?
Yeah, you can continue, ma'am.
Somebody raised hand. Okay. Then he found out this, and so we came to know that vitamin C is the cause and deficiency in scurvy, and when we give vitamin C, they are getting better. Okay, that was a breakthrough, and we call it RCT because he has done some intervention. He has given some citrus fruits, and the patient has become better. So that comes under randomized control trial. So he can, we all see, 12 sailors, they have divided into groups, and 6 groups have been given different treatments. So that comes under RCT. That is the beginning of RCT. I want you people to remember this story forever. James Lind done this. Okay. And next one is this Framingham heart study. As I told, it has been running for more than 75 years. So they have conducted initially in 1948, I think they have started it with 5,200 people in Framingham, a small town from US, and they have listed n number of associated risk factors for the cardiovascular diseases. So what they have done is, first group have been followed up for 20 years. Every 2 years they will do history taking regarding what are all the symptoms you had, and they do some of the medical examination also regarding their BMI, waist hip ratio, and blood pressure measurement. All these will be done, and some of the blood measurements also, like blood cholesterol levels. All these lipid profile itself will be done, and ECG have been taken every 2 years. All these medical interventions will be, examinations will be done every 2 years for the collective period of 20 years. Okay. So for 20 years, there was one group. Okay. And for another 20 years, there was another group, and they have found out there are similar risk factors prevailing in other populations.
Online the test
Afia? Can you mute? Yeah. So this is one of the greatest example of cohort study where you do a long-term follow-up. Okay, we know they have some of the risk factors. When we follow up them and we found out whether they had any outcome of cardiovascular diseases, that is a breakthrough study in for cohort study, which is the greatest Framingham heart study. You should remember these two studies. You will hear it here and there again and again and again. What happened? One minute, I'm not able to. One minute, I'm not able to change the slide. Excuse me. Yes. Next comes the literature search. We cannot take information that are available in Google. You have to do a proper guided search of all these literatures. Especially you can do this in 2 platforms, PubMed and Google Scholar, because all of the studies that has been published in various journals or through any of the publishers will be available in these 2 portals. Okay, PubMed and Google Scholar. This is the 2 best platforms where you can search for all the diseases, and these literature you are taking for your research, that has to be after 2020, because all these recent studies, when you in the past, all these ideas that you have now would have not been studied, but in recent years many of them have got similar idea, and that particular study has been done already, could have been done. So you have to find out the recent articles. Okay, search for the recent articles and find out the research paper which are similar to your paper, and you have to take a lot of references, almost 20 if you do any kind of research, but choose one mother article that is very similar to your literature, and that is going to be helpful in your sample size calculation. Why I'm telling you this mother article is, you will take up this prevalence from this article and you will use that in the sample size calculation. I don't want to scare you. You have to search reference articles from the PubMed and Scholar, and among that, one very similar article has to be kept as a mother article. Okay, am I clear? So we have come to the best part. What are all the steps in conducting a research? Okay, first you have to identify whether there is a problem, or do you really feel there is a gap. I want to fill it with my hypothesis. I can fill that gap, and I want to do research in that particular topic. Okay, and with that you are going to formulate a hypothesis. So you have to find out what is the topic of interest, what is the newer things. Okay, as we discussed, we have a new regimen in TB. How it could have been happened? Okay, how new that research is. So we have to know there are so many ideas that are already been done. Your idea is how new it is, how different it is. You have to justify and give a rationale to conduct this study. Okay, and you have to, based on this, you have to choose a fitting study design. So we have seen all the study designs. Among them, what is the study design that can fit your idea? You have to try that, and you have to frame the hypothesis or a study title based on these two criteria. It has to be finer and based on this PICOS criteria. Okay, finer is it has to be feasible. Whatever you try to do, it has to be doable. No, it has to be feasible, and it has to be interesting, newer, ethically possible, and relevant. What is the current problem, and what you're trying to do is relevant to the current situation. It has to be relevant to the current situation. And coming to the PICOS, what population the title has to have. What is the population you're choosing? Whom? Among geriatric population, among under 5 children, among school going children. I'm trying to do a study that has to be specified in the title itself. Okay, and what is the intervention you're going to do? Like, you are going to do this cross-section study, you are going to do this cohort study. I am going to compare these two groups. Okay, everything. What is the thing that you're going to do? You are going to see the prevalence. I am going to search for the associated risk factors for hypertension. Everything has to be put up in the title itself. And comparison, whether you are doing a comparison study with the other group or not, that also should be specified. And what is the outcome? I am going to, by conducting this study, I am going to see what is happening to this population by giving iron tablets weekly to the adolescent population. Okay, whether the anemia is reducing or not. What is the prevalence of anemia? And these many people population, around 54% of the adolescent girls in a village in Chennai having anemia. So I am going to give them weekly iron and folic acid tablets, and I am going to check it after 1 year whether they have improved or not. So that is the outcome. How many percentage of adolescent girls have improvised from anemia or improvise their hemoglobin levels is the outcome that we are going to prove. So that also should be specified in the topic. Okay, improvement of anemia among adolescent girls, this age group in this specified population we have already mentioned, and we are going to do a observational study. Everything has to be mentioned in the topic. So these are all the criteria for setting a hypothesis or a title to a research. Clear? So first we are going to identify a problem, then we are going to formulate the research question or a hypothesis, then we are going to frame the aims and objectives. So aims and objectives is nothing but, so when you have set, this is the idea. So as we can see, as we have set already, example anemia. So first thing is you are going to study the prevalence of anemia among adolescent population. That will be your first objective. Second thing is, what are all the associated risk factors for them to develop this anemia will be a second objective. And what are all the dietary methods that made them improve their anemia or hemoglobin levels. Okay, that can be your third objective. Like this, you have to divide your hypothesis itself into various objectives, and in that itself you have to keep a primary objective and a secondary objectives. Okay, primarily that this is what I am trying to convey. This is what I'm going to study. Okay, that has to be specified as objectives. Clear? Next comes the study population and study setting. Setting is nothing but where you are going to conduct the study. This adolescent girls anemia study can be done in an elementary school or any of the, if you're willing to get permission, private schools also. And you can do study in TB patients. And in a TB sanatorium, Chennai, we have a TB sanatorium. No, in that study setting, among those TB population, I am trying to do a study. In adolescent girls, in elementary school, I am trying to do a study. That is what deciding the study population and setting includes. This study population has inclusion and exclusion criteria. Inclusion criteria is nothing but what is the criteria to have these adolescent girls to participate in the study? What is the age group? Whether they have given their consent, whether they had any other diseases that can influence them to have anemia. That are all the inclusion factors. Exclusion also, if they're not willing or they're very sick to participate in the study, everything has to be given in the inclusion and exclusion criteria. And coming to determining the sample size. Based on the study design, for cross-section study, there is a different formula. For cohort, case control and cohort and RCT, all these have a different formulas for calculating the sample size. This sample size calculation, you need not to worry. Any of biostatistician or any of the people from community medicine, they will help you. You need not to learn, or you can do this simple calculation for cross-section study. It is nothing but 4 PQ by L square. In the following series, I think that will all be taught to you. But this is not a major problem for you all, because any biostatistician or any professionals from community medicine can help you with sample size calculation. And the next step will be deciding the study design and what is the study period. Because based on the study design, you have to determine how long the study is going to take. Cross-section is nothing but you go into the field, you collect the data and come back and analyze it. It takes only 3 to 4 months. Okay. Whereas in cohort, as I said, we are going to have a long follow-up in all these observation studies. RCT also will take time, minimum 6 months, because you need to get patients. No, we will not be able to get every patient at a time. Okay. So we need time for getting the patients in RCT. So for cohort, you need to have a follow-up in cohort. So based on the study design only, you can choose what is the study period you are going to have. So first step we saw what is the problem, and we are going to formulate the title or the hypothesis. We are going to frame the objectives, and we are going to decide on the study population, which population I'm going to do the study, where I am going to do the study, and based on which study design and what is the study period. Clear? And next comes the biggest part, writing the proposal or protocol. Okay. So I want you to look at an example. First, I'll explain. Okay. So writing the protocol or proposal is nothing but you have to give first, initially you have to, all these proposal can be around 500 words. Okay. Protocol, basically we are trying to explain what we are going to do in form of research. What we're going to do, we write up and submit it to the ethical committee. Okay. So first step is background. So regarding, if you take any particular disease, I'll show an example of TB proposal only. Yes. Okay. So first you have to give the background information regarding their prevalence, disease prevalence, and what are all the current data. You can take up the TB report itself, you can give a readout, and what are all the studies, literature that has been done already, and what is lacking in that literature, that you are going to fill that gap. Okay, this is what is missing in the literature search, and I am going to fill it. Okay, that will be your background, and that will be your rationale on choosing this topic. So, so these risk factors have not been studied priorly. Okay, this stigma, this discrimination, all these have not been studied priorly. So I am planning to do that. That will be your justification for choosing this topic. And you will write the objective. Okay, these risk factors I'm going to study, what are all the mental status of the TB patients I'm going to study. All these have to be defined as objectives. And you will write the methodology part. Methodology part includes study design, population. What is the procedure? What is the procedure of conducting the study? I am going to collect data and I'm going to analyze them, and these are all the population, and these are all the questionnaire I am going to use, and how methods of assessment, how I am going to assess them, how I am going to collect the data, and how my sampling methods is choosing that population, collecting data from the samples. That is selecting that samples itself is there is a method that will also be coming in the series, sampling methods. And what is the statistical analysis you're going to do? Whether you are going to have only p value, that is doing a chi-square, you are going to find out whether the values are statistically significant or not. And you can have odds and adjusted odds ratio by doing logical regression. Okay, that will show you the strength of association, how strongly these risk factors are associated to the diseases. Okay, that also can be done. And what are all the ethical consideration you are going to have in your study, that also has to be mentioned. And what is the expected outcome? By doing this study, I am going to have these outcome. Okay, so I will find out in people who are getting treatment from TB sanatorium, how what is their mental status, how useful these amount given by the government under NICSHE is, where how much useful it is, and how are they suffering to fulfill their needs, especially these financial problems. All these outcomes I'm going to look into it. Okay, this is the basic skeleton of the protocol or the proposal that you have to prepare. Okay, I'll show you one example proposal. A minute please. Okay. Yeah. So I think it's visible now. So it is a mixed method study on what are all the psychosocial barriers and what are all the challenges faced by MDR-TB patients and their caregivers also. So what we have done is we have seen many literatures, but none of the studies have covered the caregivers burden. Okay, throughout these course of diagnosis and treatment in Chengalpattu district, we've taken data from the TB sanatorium only. It was an ICMR STS project. Can you see in the introduction part? It is the background. The introduction is the background. So we have given, based on the global TB report, what is the data of the MDR-TB and what are all the risk factors of the patients and the caregivers. Okay, what are all they are suffering from, and what is the, based on the literature research I have done, caregivers, caregivers data have not been covered. So now I am planning to do a study on caregivers part. Okay, that is what we've given in introduction. Next comes the objectives. So can you see, we are going to enumerate, we are going to number what are all the challenges faced by them and their caregivers, and we are going to explore what are all the barriers and challenges they faced. Okay, that is our objective. So under methodology, as I said, we are going to do write up, study design, study setting, study population, inclusion. When you say study population, you have to write in two forms, inclusion criteria and exclusion criteria. And I have given study period. Can you see? So 2 months only. TB Sanitarium is very nearby, and I had 4 students under this study. So all of them have gone there and collected data within 2 weeks. So we have calculated the sample size. As this is a mixed method study, we have used this 4PQL square formula only and have calculated the sample size. And coming to studies tool is sampling method first. So I have chosen all the MDR-TB patients. That is comes under universal sampling. There are various sampling methods you will be seeing in the series. So there are simple random sampling, stratified random sampling, and there is universal sampling where you take all the patients, all the MDR-TB patients have been covered in the study. So that has been called as universal sampling. So we have a study tool which the assessment is done through a questionnaire. Okay, that has 2 sections, section A and section B. And what is the study procedure? How we are going to collect data for both quantitative and qualitative studies. Okay, this is a mixed method study. No, I had two parts, quantitative and qualitative, and how I am going to analyze the data for both quantitative part and qualitative part. Can you see? So this quantitative part, I'm going to enter this data in the Excel sheet, and I'm going to look into the means and proportions, and chi-square test will be done. I have put, okay, and all for this qualitative part, I am going to do in-depth interview. Okay, and focus group discussion was also done for this qualitative part. And what are all the ethical consideration? I have got permission from state TB officer, district TB officer, and institutional ethical committee approval is a must. Okay, and an informed and written consent for both from the patients and the caregivers will be obtained. Okay, this is the ethical consideration, and this is the implications. So since physical and mental health are essential for the success of the treatment, so the current study will assess the caregiver's viewpoint. Okay, that is main objective of this study. So caregiver point of view is very essential. No, the burden falls on them. So I will put with this study, by conducting this study, we will have a viewpoint of the caregivers, and that will give a comprehensive. Based on that, you can have a strategy. You can develop a strategy to compromise their, to help them overcome these challenges. Okay, this is the implications, and you have to put 5 numbers of references. Clear? So this is one of the example for proposal. We'll go back to PPT. So writing this proposal or protocol is a part of conducting a study. So after preparing this protocol, you will submit this protocol to the ethical committee, institutional ethical committee. Okay, so those people will tell you the pros and cons of conducting these type of studies, and whether it is fit enough to conduct the study, whether it will be worthy, or is there any changes or upgrades that need to be done, because various number of professions will be there. There will be one person from the medicine, one person from the surgery, one person from the OG, and one person from the community medicine, all people perspective. One person will be from law, one person from the general population. Every perspective will be they'll give an idea what can be improvised to conduct this study. And you will also submit this patient information sheet. Patient information sheet is nothing but you have to explain the patient what you're going to do, how you're going to do. Is there any benefits or any harm to the patient? You have to explain in prior what are all the procedure of your study. Okay, that is patient information sheet. And you will also have the consent form. When you do all these intervention studies, as we saw in the experimental studies, no, when you do intervention, when you do a procedure, you have to get a written consent form. I think you all know, you would have seen in the wards. Okay, similarly, when you do a research also, you have to give a written consent form and informed consent form, all these for all these observation studies. Clear? So next step will be, after the ethical committee approval, you can start collecting data. This approval has to be obtained before starting the study. Okay, now you are going to start collecting the data. You can collect the data by face-to-face interview using a questionnaire, or you can mail them, you can have a phone call, and you can do a medical examination or as we saw in the case control study, you can review their past medical records also. Okay, how were they doing? Is there any changes in the previous examination itself? All these data can be collected, and you can put up in your collected data. Okay, and then you can analyze this collected data by putting all these in Excel sheets and analyze using this recent updated SPSS software. SPSS software is very easy. For that also, I think Arnagiri, you can have a workshop if people are really exceeding in this research and they want to,
Sure, ma'am. We're having a plan actually.
Nice.
We will definitely intimate you, and I will let you know for sure,
Yeah,
ma'am.
because it is a very easy platform where you can easily have a output. Chi-square and all, within minutes, if you just click on everything correctly, you will have a report of p-values, whether you can tell whether it is statistically significant or not in chi-square test. And there are many tests that you can tell the strength of association, all these adjusted odds ratio, by doing logical regression. You have to do regression. which will give this adjusted odds ratio, which will tell you the strength of association between the risk factor, that is exposure, and the outcome, that is disease. Okay. So by analyzing these data, you will have a result and you will start writing the report. Okay. The report is nothing but writing a manuscript. Okay. What all you have done previously for conducting the study, what are all the results you have obtained, what you have compared with the literatures, previous literatures, everything should be written as a report or manuscript to submit to your journal. Okay, for that, the first part is abstract. Abstract is nothing but a concise version of the overall study. Okay, you will give aim and objective, introduction, methodology, conclusion, results, everything will be in gist form. Okay, just only few lines, 250 words can be kept in abstract. Okay, coming to introduction. So we saw in the proposal, no, similar way, you will elaborately explain all the details about the disease of interest you have taken. Okay. And next, you have to write the aims and objectives, methodology or materials and methods, what all you have used. You have to explain it in detail. And what is the results? What is the frequency? So these many males were there. You would have seen in articles, I think. Okay. So these many males were there in the study. These many females were there in the study. These many had educated, these many had belonged to upper socioeconomic classification. All these will be coming under your results, and the statistical significance and the strength of association, everything will be put up in the results part only. Okay. Where discussion part, you will compare your results with the previously done literatures. Okay. Previously there was, you have done a research, no? You would have searched for many articles which is very similar to your study, and you will have to write up whether your results are consistent with them or it is different from them. Everything has to be put up in the discussion part. At least you have to compare minimum of 5 studies with your study. Okay. And strengths and limitations. This is the strength of my study, and these are all the limitations of the study. For example, I showed one proposal, no, universal sampling. You cannot do universal sampling. That sampling method is not a good sampling method. Okay. So you have to do either stratified sampling or simple random sampling. Okay, that is some of the better sampling methods like that. And I have covered only Chengalpattu district. With this we cannot generalize the results. Okay, this cannot be applied to all the caregivers and patients. So you have to put up what is the strength and what is the limitations of your study. Okay, and with that you have to give a conclusion. So these are all the risk factors I have found out. These are all the challenges I have found out, and we can have a strategy or a comprehensive program that can help them to improve this challenges. Okay, and what are all the references you have taken from. Okay, this is the manuscript writing. These are all the parts that has to be in your manuscript. Okay, coming to ethical consideration. So we have finished all these research write-up and all. Okay, so coming to ethics, where you have to follow your medical ethics part throughout conducting the study. I think you all know these words. What is autonomy? Guys, what is autonomy? Everyone slept? I think these all has been taught in foundation course itself nowadays. What is autonomy?
One's own power to make decisions.
Yeah, patient have free will. Yes, they can, they can refute or they can accept to participate in the study, or they can tell, they have the rights to tell us that they're not willing to participate in the study. Okay, they have every right to choose whether to participate or not to participate. Okay, same way in the treatment, you have to accept their choice of treatment. You have to give them wide range of choices, and they have the rights to choose what they can do. Okay, so that is autonomy. Same autonomy has to be followed in research also. If they're not willing, we will not ask them again. We have to leave them from participating in the study. So same as in the non-maleficent, we cannot do any kind of harm to the patients by doing, especially in RCTs, no, randomized control trials. We try some of the newer procedures, for making them better only. When compared to the standardized procedure which is already existing, we are trying to do something new, which may sometimes go wrong in some of the patients. So that is why ethical committee clearance will not be given for these RCTs, very easily. So that is, we can, even if we are not doing any benefit to them, we should not do any harm to them. So that has to be very clearly kept in our mind. We should try to do the best. Okay. And beneficence is where maximum outcome, best outcome, positive outcome has to be tried and given to them. And justice, we cannot select the patients. We have two groups in all the parts. In RCT also we have two groups. In case control also we have two groups. Cohort also we have two groups, where we cannot choose who is going into the cases groups and who is going to the control groups. Especially this happens in RCT. Okay, so there will be two groups, Group A and Group B. Group A will have this standardized procedure. Okay, where they will go into the treatment and they'll finish. Or sometimes we will give this comparison group a placebo. So we are trying to find out the efficiency of a drug. Okay. So hypertension, so hypertension, we are trying to develop a drug. We are trying to evaluate the efficiency of the drugs. We are giving this newer drug to some of the patients, and we are giving placebo, some multivitamins, to the group B. Okay, so I am the investigator. I am choosing which patient has to go into the group B and which patient has to go into the group A. How can we do that? No, it cannot be done at all. It is not justice at all. So it has to be blindfolded. That is there are various types of blinding in for biases. So you have to be very justified that no, you cannot choose, or you cannot be biased in choosing the participant to go into which group. Okay, whether in the procedure group or in the placebo group. Okay, so we have to be very justified to the patients. So you have to follow these 4 things in research. And next part is avoid all these plagiarism. So as we are all into AI, there are many AIs which can do this research work in a minute. Okay, so it has replaced all of this, but not in an efficient way. We also have to put up time and work. Okay, it can give a overall idea. It is not as good as we think. So people are, I can tell you, they're a bit exaggerating. With our minds only, we can have a good research. With the AI, it is not good enough, actually. So with plagiarism, people are fine. Now the journals have put up a certain criteria for plagiarism itself. There are some percentage. There are apps which can find out plagiarism now. They have to run into the plagiarism app, and then only they will accept for the journal. So 10%, 14% plagiarism is accepted, not beyond that. So you have to be very careful, and you should not fabricate or falsify any data. Okay, so any of the misinformations, they're not encouraged at all. So if you're not able to find out 200 patients, you have to do it in 100 patients itself. Okay, you have to justify that, and you can change the protocol itself. Okay, you cannot fabricate these 100 data to 200. That is not ethically correct. Okay, so all these false data also should not be done. Okay, and faulty, questionable data gathering procedures, like recently one thing happened. I gave this menstrual hygiene practices to our interns, and what they've done is, we were planning to do this study in a urban slum area where we are having a field practicing PHC there. Okay, in a urban slum, they are being posted there only. But throughout the period, 3 months, they did not collect data. In the last 1 week, what that one person has done is, they have put this Google form into the Instagram story, and they've collected finished data. I was so surprised. How can you collect data in 1 day? What has happened? How is it even possible? I was like so shocked. And then I was like politely asking them, so what has happened? Tell me the truth. I want to know the truth. Okay. So they told me the stories, and it is not a correct way. You cannot do this. Okay. Even though it is very funny, and I was like, oh my God, how come you had this idea like that and all? I was also shocked, but you cannot do this. Data gathering procedure should be followed in a certain way. where it has to be done in a particular format. Okay, how you have kept told in the procedure, so you should have mentioned that in the protocol itself. Okay, if you are going to do like this, you have to mention it in the protocol that I am going to put up this Google form in the groups only, like that. Okay, but you have told them as I am going to collect this data in the field. How can you do this in the Instagram story? No, this is not good at all. So don't do this. Okay, I want you people to remember this as a bad example. Okay, don't think this as an idea. Okay, and you have to get the informed consent, and you have to maintain the privacy and confidentiality of the patient informations. So there are certain diseases where patient is not willing to expose their disease status, especially all these TB, also TB, leprosy, HIV. They are not willing to tell others, know others that they are having these diseases. Okay, so we should also maintain that confidentiality to make them to will all these follow-up studies and all, we need to go back to them. So we need to maintain this confidentiality to gain their confidence. Okay, and we have to maintain all this. And misleading authorship, so whoever have participated in the conducting the study, they should be given authorship. Like one is done doing the study and other is getting the authorship is not right. Okay, this happens when you why I'm telling this is you will get to know once you write the manuscript and try to publish it. Okay, and one important thing is you have to get the approval of institutional ethical committee board. Okay, that number, they will give one number that is being asked, and the certificate itself, the scanned copy of the certificate itself is asked in the all these indexed journals like Scopus index journals, Web of Science index journals, all these DOAJ, all these journals are asking for this IEC number and this letter itself. Okay, when you submit the manuscript, you have to submit the IEC letter also. So this is very important. Ethical approval from the institution committee is very important nowadays for publishing the study. Not this, we are not doing this research and all for simply for time pass. No, we want it to be published. So for that, we need IEC approval. Okay, I think I'm clear. If you people have any doubt, you can ask me or in the chat also. I think I covered what been asked me to clearly say. If you have any doubts, you can tell me. Arnagiri has my number also. You can contact me anytime regarding this research. I can do any kind of help for you all people. As you're all very interested, I'm so glad that these many people are interested and trying to learn something at this age. I'm so happy. So I truly want to help you people. So whenever you want any help, you can ask me. Even though if you're not getting any idea from today's session, it's okay. I am here to help you people. Okay. Thank you so much.
Yeah, thank you so much, ma'am. Definitely, I will share your number to them. And
Yeah.
I want to conclude with a word of thanks. Over to you, Suganya.
It's really very helpful, ma'am. Very thankful to you, ma'am, for spending your time for us. And it really helped a lot to us to learn many things. And thank you so much, ma'am. And your help's all we need, ma'am. We will be contact with you, ma'am.
Yeah, sure. Thank you so much. Thank you so much. You people are very lovely audience, and many of you have commented and all. Thank you so much.
Actually, we have to thank you for this holistic approach to our research methodologies and giving you ideas and the real-time experiences, ma'am. Because those things are happening in real life. You just pointed out and you told like it shouldn't be happen, and you should take care of that thing. And you just showed an example for how you gave the direct example as a mixed method study itself, ma'am.
Yeah.
And yeah, that's so wonderful to see, ma'am. Thank you so much for your time and your delightful session, ma'am. Thank you so much, ma'am.
Thank you, and I'm glad that it was useful. And I want you people to use this opportunity and do research. Okay.
Surely, ma'am. And on this occasion, I want to ask you one thing, ma'am. Could you take some of our participants as can you mentor our team, ma'am?
Definitely, I'm ready. If you're interested, definitely. You have some idea, you can pin me and you can text me.
Surely, ma'am.
I will help and guide you.
Surely.
I'm so happy.
Yeah, thank you so much, ma'am. We are so happy to have you with us, ma'am. Thank you so much. Thanks for everyone for joining this session, and meet you also in the next session. Thank you so much, and thank you so much to my team as well. Thank you so much, ma'am. Bye. Good night, everyone.
Guys, thank you.